Well, there is an increase in food allergies. I think part of the explanation for that is we live in a more sterile environment. So when we do get an infection causes more inflammation. We get more of a leaky gut, permeable to proteins. And then infants and children who present with these increased food allergies, it's because they haven't been accustomed to seeing those proteins that are in foods.
98, there was a new disease that was discovered where the allergy affect the esophagus. Is that possible?
Eosinophilic esophagitis. If you are exposed to certain food that you're allergic to, you can get inflammation in and throughout actually the entire GI tract, the esophagus, the stomach, the intestines, and the colon.
Did it exist 30, 40, 50 years ago?
I think it did. I think people are now more aware of it and are able to take biopsies and look for it.
So some people say it didn't, and a lot of people say it did. It's a little controversial because we weren't looking for it, so maybe it did exist. But if it did, it wasn't the same numbers today, because I hear as much as 8% of kids under 3 now have some legitimate food allergy. Is that true?
It's true, but we weren't biopsying as many kids years ago. If something bothered them, you would have just done an elimination diet.
But as you get dealt with, that numbers usually go in half. So maybe a lot of the food allergy seems to, as time goes on, the body can handle it better.
What happens as time goes on, you build up tolerance. So only 4% of adults might have this compared to 8% as children, which is one of the reasons why some pediatricians are now introducing food at a younger age than at 1 year of age, so that the children will build up tolerance to things that have classically.
And looking for the studies that are coming down, we don't know. We think we have ideas, but it's like anything. Whatever we say today may not be true in 5 to 10 years. Is that true?
For sure. Studies change over time. Some of the foods that they're introducing earlier so that kids do build up tolerance to include the most common food allergies, which is cow's milk, eggs, soybean, wheat, peanuts, other tree nuts, fish such as shellfish, clams, shrimp.
Okay, I spoke to one of the good pediatric allergists. He's still at the school, don't give these very allergic foods like shellfish and peanuts to a later date. And he says, well, I'll keep watching these studies because somehow I'm not comfortable giving something that early. The kid develops a real severe peanut allergy at 18 months. It's a real problem. Aren't they doing some strange things to these kids in school? They're putting on separate tables so they have a peanut allergy. Are we making these kids have a problem of socialization now?
In addition to socialization, I'm worried that 20, 30 years ago when we didn't have this separation and kids did get exposed to it, maybe they did build up a tolerance earlier. And now by separating it or not allowing it in school, you may be allowing the allergy and the immune system to have a harder time to deal with it.
And there are ways you can desensitize, say, to peanuts, not easily. I mean, Hopkins and a few places are doing it now. If it's severe peanut allergy, it's something you could look into.